listening to The Voice of Russia in London. I'm Daniel Cinna. Older women and couples struggling to have a baby should be offered greater access to IVF treatment. That's the view of the National Institute for Health and Clinical Excellence, who say that IVF should be offered after 2 years of failed attempts, a year earlier than the current guidelines. And they say the upper age limit should rise from 39 to 42. The rules will also mean that lesbian couples with fertility problems will also be offered IVF treatment. The Office for National Statistics say 1 in 5 women reach their mid-40s without giving birth, nearly double the proportion of the previous generation. Meanwhile, in 2011, nearly 14,000 women became pregnant using IVF treatment. But the British Fertility Society says there's no prospect of any immediate changes for patients, as in the past, NHS trusts haven't been able to afford to meet the recommendations. Each round of IVF treatment costs £3,000. Well, joining me for today's discussion is Josephine Quintavalle, founder of the campaign group Comment on Reproductive Ethics. They facilitate debate on ethical dilemmas surrounding human reproduction. Peter Tatchell is one of Britain's most prominent human rights campaigners. Susan Seenan is the Deputy Chief Executive of Infertility Network UK. They provide advice and support on infertility. And Peter Saunders is Chief Executive of the Christian Medical Fellowship, who support doctors and medical students on issues of Christianity and medicine. We'll begin with Peter Saunders. Do you welcome NICE's recommendations?
Well, I think we've got to recognise that infertility is increasing, and it's something that produces a huge amount of pain for many couples, and I want to emphasise that in starting the whole issue. But in looking at this thing, my response would be that, like the Irishman asked for directions, I wouldn't actually be starting from here. And I think we've got to ask the bigger questions of how we got to be confronting this question already as a society.
Sure, let's hear from Peter Tatchell.
For me, infertility is first and foremost a medical problem. It's the fact that certain couples do not have the biological capability to have children, but emotionally and psychologically they feel a great need. And I think it would be very wrong to deny them the opportunity to have children via assisted reproduction if we have the technology and the will. I think it's really important to acknowledge that there are so many couples in different types of relationships who desperately want to have children, who feel incomplete without children, and who could provide a loving home to children. So therefore, why shouldn't they be able to avail themselves of this treatment?
Susan Seenan from the Infertility Network UK. Do you welcome NICE's recommendations?
Yes, we do. Infertility Network does welcome NICE's recommendations. Our big concern, though, is that these recommendations have to be implemented by the PCTs if they are actually going to make a huge difference to anyone suffering from infertility across England and Wales. The current recommendation recommends up to 3 cycles for eligible couples, but because NICE is only a guideline, the PCTs are not obliged to follow. And what that means is that people trying to access fertility treatment in England and Wales face a postcode lottery where it really depends where you live, whether you can actually get treatment or not. And that's very unfair.
And Josephine Quintavalle from Comment on Reproductive Ethics.
Well, 2 issues. I think you have to divide the older woman from the same-sex couples. In the older woman, I suspect, would be throwing good money away, in actual fact, because if you look at statistics of IVF, the older you get, the less successful it is. Women have a biological clock, and it's useless for them to deny that. So we should be encouraging women to have children when they're younger. As regards the other issue of same-sex couples, this involves the bodies of other people. There's just a big scandal in Romania on sale of eggs. The police have investigated shocking sort of horror stories there. So you're not talking about something intimate between 2 people, but you're involving third parties. And I think there are a lot of issues there that need to be unravelled.
Peter Tatchell, do you want to respond to that?
Well, I think it's certainly true that there are increasingly numbers of same-sex couples who are in long-term stable relationships. These relationships are akin to marriage. They're based on genuine love and commitment. They're just as real and true and sincere as any heterosexual relationship or marriage. And for many of those same-sex couples, For them, they have the same desires to have children like everyone else. For them, it's just part of their fulfillment and also their bond as a couple. So, we already have the experience that many thousands and thousands of same-sex couples have had IVF treatment or donor insemination from friends or family, and the end result has been very happy, successful young kids who grow up in loving, stable households. So I don't see any reason why this service should not be available to those people as well.
Peter Saunders, did you want to respond to that?
Well, I think the postcode lottery is a huge reality here. NICE is basically saying that the taxpayer should pay for this, and yet we know that the NHS already is under huge financial constraints. They've got to make £20 billion of efficiency savings in the next 4 years, and only 1 in 4 trusts at the moment is even supplying the 3 cycles. And as Susan just said, it's the PCTs, or what are becoming the clinical commissioning groups, that are going to be making the decisions about whether this gets funded at all, and it's pretty unlikely that it's going to be. I think we need to ask the question, why is it that infertility is increasing so much? I think it's the answers to those questions that we really need to be addressing as a society.
Peter Tatchell.
Can you give us an answer? Why do you think infertility is rising?
Well, I think infertility is rising for a number of reasons. I think more and more women are deciding to put off having a baby. The best time for a woman to have a baby is in her 20s or early 30s, and many are leaving it far too late, so the biological clock's ticking. But also, there are certain forms of infertility that are increasing, particularly tubal infertility, and that's related to the huge epidemic of sexually transmitted diseases, chlamydia, blocking tubes so that women cannot conceive.
Susan, everyone around the table has said that they feel sympathetic with childless couples. How do the people that come to you feel, and what do they tell you?
The people that come to us tell us quite often that they feel very isolated, they feel very alone, they feel as though they are suffering in silence because they can't share how they're feeling with other people. They feel that friends and family are having babies just left, right and centre, and it's very, very difficult for them to see somebody else that's got pregnant, whether that's at work, whether it's a friend, another family member. They feel as though they've let themselves down, they've let their partner down, they feel they've let their family down. For somebody who is trying to have a baby, reproduction and reproducing is one of the most fundamental, basic biological things that a woman can do. And when that process breaks down, it just completely and utterly devastates some people. Not everyone. Some people can accept that they're not going to have children. But for many, many people, the finding out that they can't have a child just has such a huge physical, emotional and psychological impact that it's very, very difficult for them to actually see any future without children. And I have actually been through that process, and I remember only too well the feelings that I had at the time. Nothing at that point could have consoled me and made me feel that I was actually a worthwhile person until I had worked through the difficulties of trying to conceive. So huge impact on people, very, very difficult for them to come to terms with the fact that their basic biological process doesn't work.
You mentioned before about the funding behind this. Do you think there's going to be some kind of lottery almost, as local NHS trusts won't have the funding available to them?
Well, that's what we have at the minute. Basically, we have this postcode lottery where it depends where you live, whether you can access treatment. And I think that's the biggest single issue facing anyone suffering from infertility. If you're suffering from a medical condition, it shouldn't matter where you live, whether you can access treatment. And I think what we would really like to see, and what we have to see, is some kind of level playing field where the PCTs and the new CCGs actually recognise the treatment of infertility as an illness, because it is an illness. It's designated an illness by the World Health Organization. NICE, who are the body of experts, have looked at this and, based on cost and clinical effectiveness, are making their recommendations.
But some critics have said that at a time when A&Es are closing, NICE has to make difficult decisions on life-saving drugs. Why should IVF take a precedence over saving lives?
We're not asking it to take a precedence over saving lives. The NHS treats a lot of conditions which are not life-threatening. We don't just treat life-threatening illnesses on the NHS. There's lots and lots of different conditions there. turn the question around a little. Why shouldn't IVF treatment, why shouldn't infertility be treated like any other illness? Because that's what it is. People in general going through fertility treatment, they haven't chosen to be infertile. They don't choose to have some kind of condition which stops them conceiving.
Peter Saunders from the Christian Medical Fellowship.
I think we have to be careful about talking about infertility as an illness. For some people it absolutely is. If you've got ovarian cancer and you can't produce eggs, or if you've got blocked tubes and you can't transmit eggs, then you are talking about infertility as being the product of an illness. But if a woman's simply got a biological clock ticking, then it's just normal biology that means she can't. And there are many countries, for example in France, they'll only fund IVF for people with genuine illnesses. And we've got to ask the question, why are we providing this incredibly expensive treatment with, even in the best hands, a 70% failure rate? So you're not looking at £3,000, it's close to £10,000 per take-home baby. Why are we funding this at a time of economic recession when health budgets are being squeezed for people who don't even have an illness? And if there are women listening to this, and I'm sure there are many, my advice would be as a doctor, have your babies early when you're in your 20s and 30s. Don't trust this expensive technology which probably won't deliver and will leave you on an emotional roller coaster.
Let's bring in Josephine Quintavalle from Comment on Reproductive Ethics. Why are we providing this then?
Oh, I do accept what Peter's saying. He's absolutely right. And the NHS is meant to be preventative, not to sort of get in at the very end. I just do not understand why women do not know more about their own biology. And I think we do have to start to educate them to say, don't wait too long, be careful and protect.
Do you think women don't know at the moment?
No, they don't. I think we've never had more access to knowledge, and women have never known less. I think their whole reproduction has been either handed over to contraceptives, they'll look after it. At the end of if I wait too long, who cares? The IVF will step in. And it seems extraordinary. And that's what we try to do, to say, come on, women, wake up. You should take charge of your bodies. You're always talking about it. How about starting to do it? And that's why I find difficulty when this particular approach means that you have to go and help yourself to somebody else's eggs or to somebody else's uterus. If you look at some of the stories of surrogate motherhood in India, it's absolutely nightmarish how we are exploiting very, very vulnerable Indian women to carry our babies for us. There's even in one of the contracts that I read a horrifying clause that says if the surrogate mother should go into a sort of terminal state during the pregnancy, but it's still close to delivery, she must be kept on a life support machine. So from feminist perspectives, women are doing some pretty dreadful things to other women's bodies.
I'm really worried about this exploitation issue and women being exploited, and the ignorance as well, because wombs are being bought and sold, eggs are being bought and sold, and who is it that provides them? It's poor women in India, it's poor desperate women in Eastern Europe, it's cash-strapped college students, and there's a whole lot of exploitation going on, and a lot of it is because women in this country are not being properly educated about when they need to have babies, and so they're looking to find their eggs and wombs elsewhere.
A reminder that you're listening to The Voice of Russia in London. I'm Daniel Cinna. Joining me for today's discussion is Josephine Quintavalle, founder of the campaign group Comment on Reproductive Ethics. They facilitate a debate on ethical dilemmas surrounding human reproduction. Peter Tatchell is one of Britain's most prominent human rights campaigners. Peter Saunders is the chief executive of Christian Medical Fellowship, supporting doctors and medical students on issues of Christianity and medicine. And joining us over the phone is Susan Seenan. She's the Deputy Chief Executive of Infertility Network UK. They offer advice and support on infertility. What are the main reasons why some of the women that come to you haven't yet conceived a child?
Most of the couples that we speak to are actually they tend not to be couples who've left it too late. They tend to be couples where they are actually suffering from some kind of condition. And that might not just be the woman's condition, it could be a problem with the male infertility as well. But I think Josephine has made some really good points there as well about educating women and educating couples. We have been trying for a long time to get the message out about educating people about their fertility. And in Scotland, the Scottish Government have actually this year funded a fertility education project. And we're hoping to take that message out about your fertility, about how important it is to preserve your fertility, and the the fact that the best time, if you can, to have your children is when you're younger. Now, it doesn't always work out that way for people, but at least if they have that message and they know that IVF is not necessarily going to be a catch-all if they do leave it a little bit later, then they're taking a bit more of an informed decision. And I think educating people is a huge issue in this country. Josephine's right. We know so much, and yet women actually don't seem to understand the dangers of leaving it too late. And I'd like to see a similar education project being rolled out in England as well.
Sure, Peter Tatchell.
I absolutely agree that prevention is better than cure. IVF treatment should be a last resort, and we do, as other people have said, need to educate young women and men about the biological clock.
Isn't it difficult for women that want to have a career? They seem to be having to make this decision between having a baby biologically and having a career because there isn't affordable childcare. We keep hearing this.
Well, that's why, affordable childcare is such a fundamental aspect of empowering women and liberating women from having to make these awful choices between motherhood and a career. They shouldn't be having to make that choice.
Can I just make one point just very quickly there as well? Quite often, actually, we speak to women where it's the man, the male partner, who has said that they don't want to have children younger. It's not always the women that are making that decision. Quite often their partner is saying, no, I'm too young to have a baby, we need to put it off for a few years. So I think educating men is a big issue as well.
Peter Tatchell.
Another issue, I think, is the whole question of environmental factors that are contributing to infertility. We live in an increasingly chemical-based society, and there's a growing body of evidence that some of the chemicals in our everyday lives are influencing fertility to the detriment. And I think, as a society, we need to tackle those issues, the kinds of chemical exposures that men and women are experiencing, which may diminish their fertility.
Josephine Quintavalle.
Other factors which are important, it was actually, Peter, when you said growing body, because overweight is a big contributing factor to infertility, as is underweight. Anorexics have great difficulty conceiving. There are other issues such as smoking, lifestyle issues. I think here again, if we're working to protect the fertility of the nation, we've got to make these things very clear. And the United Kingdom has got a real problem with obesity at the moment, and it is, particularly difficult to get pregnant. So I think we've got to put all of these eggs into the basket.
So as well as the education programs, which hopefully will then impact on a few years down the line, obviously they are trying to deal with IVF right now. How do you feel about the extended age up to 42, and do you think that could be extended even further?
Well, the question that NICE is addressing is whether we should be funding this. And I think you can only answer that question in the light of the other priorities of health funding. And I think people with genuine illnesses, whether it's cancer or heart disease or whatever, need to take priority. I do think that some fertility treatments should be funded and paid for when there's genuine illness behind it. And obviously the private sector offers anything that people want. But I think there's a real question about what our priorities are, and should we be providing these expensive high-tech treatments to people who don't actually have any illness but just have a ticking biological clock.
The private sector might be there for people that can afford it, but you're hearing terrible stories of people having to remortgage their houses, take out bank loans just to be able to afford to have a child.
Well, you're saying people having to do this, people are making the choice to do this, and often it's because they've made other really important lifestyle choices beforehand, perhaps to put career before family until there are time when they're not really fertile. So
should there be universal access to IVF?
No, absolutely not. And the taxpayer should not be paying for it, in my view. It's not a priority. What we need is to address these bigger questions and have better education. And as I say, any woman listening to this, if you want to have a baby, then have it early on, get in a secure relationship early on, have it then, and then as well, you're much more likely to succeed, and you also won't be looking after teenagers in your 60s.
Josephine Quintavalle, according to Peter Saunders, there shouldn't be universal access to IVF, and we should be prioritising other illnesses.
Well, no, I usually agree with Peter, certainly when it comes to rugby. But I just wanted to talk about something that I explored before I came on today, and that's about cheaper ways to deal with infertility. And I think we should be more conscious of them. First of all, I've mentioned healthcare education, so we try and prevent. But there are, for example, I'm a great enthusiast of minimum stimulation cycles, where you use fewer drugs and you might have to do more than one cycle, but that would significantly reduce the cost of IVF. And another procedure which is part of fertility treatment that I discussed with one of my friends who's a bit of a sperm expert, and he said that in older women they could have access to more cycles of treatment if there was greater use of both minimum stimulation but also of IUI, which is intrauterine insemination. So it's not creating the embryo outside the body but targeting when the woman's most fertile and sort of trying to pinpoint that moment. So that would be much more cost-effective, I think, in dealing with it. I will accept absolutely that people can be absolutely heartbroken about not having children, but we have a duty, therefore, I think, to educate the country to understand more about, and certainly to this issue of overweight, which is a very significant contributor to a lot of other health conditions as well.
Just to come back to what was said earlier as well, IVF treatment or fertility treatment in general, we do believe should be available for people who have a fertility problem. And that's what I think we should be talking about. It's only people who have a genuine fertility problem who should be able to access treatment on the NHS. But those people who have a fertility problem should be able to access it equitably across the whole of the NHS. And I think we have a huge role to play in educating people, not just women but men, because quite often, there's a lot of talk here about telling women they have to have their babies early. But they have to convince their partners, and the men quite often don't want to have babies when they're in their 20s. They feel they're not ready for it. So it's not all just one-sided here, but I think we have to educate people. We have to look at alternatives to IVF, where these alternatives will work for people. And people need just to be better informed and need to understand that IVF doesn't always work. It's not always going to work, especially as you get older.
A reminder that you're listening to The Voice of Russia in London. I'm Daniel Cinna. Joining me for today's discussion is Josephine Quintavalle, founder of the campaign group Comment on Reproductive Ethics. They facilitate a debate on ethical dilemmas surrounding human reproduction. Peter Tatchell is one of Britain's most prominent human rights campaigners. Peter Saunders is the Chief Executive of Christian Medical Fellowship, supporting doctors and medical students on issues of Christianity and medicine. And joining us over the phone is Susan Cinna. She's the Deputy Chief Executive of Infertility Network UK. They offer advice and support on infertility. Peter Saunders, coming in on an earlier point that Susan Cinna made about equitable access to IVF.
Well, I think there are limits to what we can provide in the health service. As I said, I think a key issue is whether there's an underlying illness. But we've also got to ask questions about a treatment which, even in the best hands, has a 30% success rate. So that's a 70% failure rate. And once you're getting past 40, the rates of success are much, much lower.
Shouldn't we be trying to help these women that are trying to have children?
Yes.
Isn't it worth trying?
Well, the thing I started right at the beginning and said was, we've got to take on board, first of all, the pain of infertility and the way many suffer. But it's the solutions we're arguing about. And I don't think the answer is more and more high-tech fertility treatment funded by the taxpayer. I think the answer is much more along the lines of addressing the big societal issues that I talked about addressing lifestyle factors that Josephine and Susan were talking about.
Peter Tatchell, you wanted to come in there.
But I would say that it is a fundamental issue here, that it's so unfair that women in some parts of the country get the option to have this treatment and others in other parts of the country don't, because the decisions of the local health trusts decide, and it shouldn't be, a partial system. This is a national health service. It's meant to apply across the board to all people throughout the country, and quite clearly, some women, just because of the virtue where they live, are not having those opportunities.
But there's a postcode lottery for just about everything on the health service. Well, surely you're not suggesting that all of these micro decisions should be made centrally by government. Aren't we already too top-heavy in terms of decision-making.
No, I do agree that when it comes to people's health, we should have a national health policy, and it shouldn't matter where you live. You should get the same rights, responsibilities and treatments wherever you are, whoever you are.
Josephine Quintavalle.
The National Health was founded on prevention, not cure, actually. The whole idea was a healthier nation, and so that these things wouldn't come about.
How effective do you think education can actually be? Because it strikes me as education might help now and it might help the generations down the line, but we still have an issue to deal with at the heart.
Well, I'm afraid we're just going to have to deal with the economics of today as far as today's concerned. But I happen to have all male offspring and sort of discuss this with them, and they're not all married, and we don't sort of have enough grandchildren from my perspective. But as far as they're concerned, there's a kind of new sort of terror in some of my son's friends, etc., that there's this picture of the woman who's gone and put her eggs in the freezer so that she can get on with her career, etc., and then comes to the cocktail party and is looking out who's going to be the right man for the job, sort of thing. So there is that sense that particularly professional women think they can wait forever, and that there are all kinds of other solutions. I think we have to ensure that reproduction is respected socially and that people don't lose their jobs. Very difficult to be a lawyer and keep going in your career if you take time off to have a child. So that's, looking at the young professionals. Susan
Cinna, looking at the generations down the line, you'd obviously prefer it when your organisation isn't needed.
I would love to see the day when our organisation wasn't needed, but at the minute in particular, I just don't think that will ever happen. We will always have people struggling with infertility. We'll always have people who need support, advice and information, and who need somewhere to come. And a lot of times people finally find us and then they actually say, I wish I'd known about you earlier, because they feel very isolated and very alone. And I think it's important that they know that there is somewhere they can come for information, that they know someone is fighting their corner. We lead the National Infertility Awareness Campaign, which is the lobbying campaign for fair and equitable treatment across the country for infertility patients. And this year, to mark our 10th anniversary, we're actually launching our Talking About Trying campaign. And Talking About Trying aims to end the sort of isolation and the stigma surrounding infertility, to get people talking about it. And as part of the Talking About Trying, we're going to be talking about trying to educate people more, as well as talking about trying when you can't access treatment on the NHS, and you should be able to. So I think lots of work needing done, lots of work will continue to be needing done as long as people do sadly suffer from infertility.
You're listening to The Voice of Russia from the heart of London. On weekdays we broadcast live from 4 p.m. until 8 p.m. We'll bring you news, current affairs, features and debate. Now you can listen to us on digital radio and online. Visit ruvr.co.uk.
Well, unfortunately, we're out of time for today's discussion. Thank you to all of my guests. Josephine Quintavalle, founder of the campaign group Comment on Reproductive Ethics. They facilitate debate on ethical dilemmas surrounding human reproduction. Peter Tatchell is one of Britain's most prominent human rights campaigners. Peter Saunders is the chief executive of Christian Medical Fellowship. They support doctors and medical students on issues of Christianity and medicine. And joining us over the phone is Susan Cinna, the Deputy Chief Executive of Infertility Network UK. They offer advice and support on infertility.